Well, welcome everyone. You found us again here at our weekly COVID-19 situational report from Peterborough Public Health. I'm Brittany Cadence, Communications Manager, and very pleased that you could join us here today on this nice, sunny, warm day as spring is making itself known and everything that comes with it. So what I would like to do is welcome you. Very pleased to have many of our elected officials joining us today, and we hope to hear from you later. So to move us along, I'm going to start us off with a land acknowledgement. And on this beautiful day, we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, to start us off then, I will now invite our board chair, Mayor Andy Mitchell from Selwyn Township, to lead us through some opening remarks. Please go ahead, Mayor Mitchell.
Thanks, Brittany. As the Premier indicated yesterday, we are now battling a two-front war against COVID-19. The first is to stop the current rapid spread of COVID and relieve pressure on our hospitals and ICUs. In response, the government has introduced a new stay-at-home order with strict guidelines to leave home only for essential purposes and to remain in our local communities and avoid all non-essential travel, even within the province. The second is to accelerate and target vaccine rollout so that both those who are at the greatest risk of mortality, those over 60 years of age, and those who are required to work in high-risk congregate settings where COVID is rapidly spreading are prioritized. As the Premier also said, both of these efforts will require the cooperation of each and every Ontarian. In the past year, our Peterborough area residents have risen to the challenge. Despite the economic, social, and psychological costs, our residents have made the necessary sacrifices to keep themselves, their families, and their community safer. To our healthcare professionals, to our first responders, to our essential workers, to our teachers, to our business community, and to everyone else, I extend a deep thank you. I am confident that our community will once again rise to the challenge. We have made progress in terms of our vaccine rollout as all levels of government, public health staff, other professionals, and volunteers have come together to make it happen. Over 84% of our seniors 80 and over have been vaccinated. More than 30,000 local residents have received at least one dose, and vaccine hesitancy has not been evident in the Peterborough community. This is important because the Peterborough region is an at-risk population. Peterborough has the highest percentage of older adult residents in the province. 22.3% of our community is 65 and older, and as the Premier reminded us, most COVID deaths are occurring in those over 60. The proportion of variants of concern as a percentage of our total cases is amongst the highest in the province, and it is spreading in our community. In addition, every week, large number of people from the province's hotspots travel to our area, creating additional exposures. With this in mind, it will be important to meet the objective of providing one vaccine dose to every resident 60 and over, and every resident classified as having a high-risk condition by April 30th. This will require that as vaccine deliveries to the province increases, that the scheduled shipments to our area also increase. These next few weeks will be difficult, but together, with the help of the federal and provincial governments, as well as members of our community, we will meet the challenge. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. Okay, so now to lead us through the current statistics over the last week, I invite Dr. Salvaterra, our Medical Officer of Health. Please go ahead, Dr. Salvaterra.
Hi, thanks, Brittany, and hello, everyone. Thanks for joining us today. So as of 4:30 p.m. yesterday, there were 89 active cases here in Peterborough, 37 more than were reported to you last Thursday. Our total case count stands at 949 cases to date, which is an increase of 74 more than last week. We've also seen an additional 53 of these cases being identified as variants of concern. The number of high-risk close contacts stands at 246. That's 48 more than last week. You can see across the board that all indicators are trending upwards, driven by the variants of concern. And what's equally concerning is that this jump is not due to outbreaks in a particular setting. Most cases are from individuals who are not sure where they were exposed. So far today, we've had another 4 new cases reported to us. And sadly, as you will see, the number of local cases, local deaths has also increased by 1 and now stands at 11 local residents who have died of COVID-19. Next slide, please. We're looking at new cases by the week, and the bar graph shows the weekly numbers continuing to fluctuate. It's a bit of a bumpy ride. I'd say it's still very volatile. So far this week, there have been 31 cases reported. Last week, we were at 21 at the same time on the Thursday. So we're definitely tracking to be one of our higher week totals. And we are coming out of a holiday weekend. So depending on how well that lockdown was adhered to, we may in fact be beginning to see that typical post-holiday surge. Next slide, please. We're looking at the monthly case counts. And I guess, I mean, we all know that March was a record-breaking month for us. But I think given that we are now in an emergency situation with a stay-at-home order, I think it's important to look at what happened in February, which demonstrates that lockdowns are effective if they're kept in place long enough. So that should give us some hope. Next slide, please. We'll look at exposures. Again, this remains consistent over the previous weeks, with the largest proportion identified through contact tracing of high-risk contacts. It's good to see that there have been no cases related to travel over the past 4 weeks. Go Peterborough. We have to keep it that way as we make our way through this current lockdown. Next slide, please. There are 5 active outbreaks in our community at the moment, and all are stable. The outbreak at Trent University's Zosky College student residence was declared over last week, but then a new outbreak was declared at Trent's Champlain College Annex residence. Surveillance testing was conducted there yesterday, so we'll have those results soon. We have 2 outbreaks in workplaces. They are stable. On Sunday, we declared an outbreak at Thomas A. Stewart Secondary School, and we have 2 student cohorts that are affected there. One cohort was assessed as high risk, so they're all self-isolating until the end of day, April 14th, and the other was considered to be a lower risk exposure, and they are self-monitoring until April 9th. The outbreak at Empress Gardens is stable, and all results came back negative after the most recent round of testing. I wish to extend my condolences to the family that has lost their loved one to COVID. Peterborough Public Health, our mobile team, did go into Empress Gardens on March 10th to administer the first dose of the Pfizer vaccine. But unfortunately, when we look at the onset date of the first case in that outbreak, it appears that the residents were exposed just about 1 week following that first dose, which was just too soon to have them acquire any immunity from the vaccine. So that explains why so many did fall ill. We have a total of 8 residents there who have contracted COVID, and as I have shared, 1 unfortunately has died. The residents of Empress Gardens have received their second dose of the Pfizer vaccine on April 1st. So looking to the future, soon they will be well protected. This outbreak and the related illnesses, though, are a sober reminder of really 3 things. First of all, of the vulnerability of this sector of our population. Also of the fact that the vaccine takes at least 2 weeks to generate a protective immune response. And thirdly, just the ongoing need to follow all of our public health measures in order to keep everyone safe, even after 1 dose of the vaccine. We'll look at our incidence rate, and here you can see on this slide on the right-hand side that our incidence rate has nearly doubled from last week, from 28 cases to 50 cases per 100,000. The map shows the cumulative case incidence rates across the province since the pandemic began. Next slide, please. Here we have our latest surveillance source, which is the testing of wastewater at the Peterborough City Treatment Plant. And if you look at the blue bars, that's the testing results of the wastewater. The red are our case counts. So as you can see, the last few days of March have shown a sustained increase in viral detection in the wastewater, which does not bode well for us. It does suggest that we can expect to see more cases identified in the coming days. Next slide, please. And on to the best news, that is that we have now immunized more than 34,600 people. The majority of those are, in fact, Peterborough residents. I think about 2,000 are from neighboring health units, but that's good. We're happy to immunize our friends and neighbors. Last week, we also administered an additional 2,455 second doses, which brings our overall coverage rate here in Peterborough to 21.2%, which is excellent. So we're doing a great job, Peterborough. Thank you so much to everyone who's involved in this massive effort. So I'd like to make some additional remarks. Certainly, I'll start with the fact that the state of emergency that was declared yesterday by our Premier is meant to significantly reduce mobility and travel. I'll say that again, mobility and travel, in an effort to stop the virus and allow more time for more Ontarians to be immunized. So Peterborough, we know what we have to do. We have to stay home. We have to stick with only the people we live with. It's virtual socialization only. That's phone and online for the next 4 weeks. Please go outside to exercise, but leave home only for essential purposes, which will be school, picking up essential groceries or medications, or if you are an essential worker who can't work at home, to go to work. It means that there should be no visits from grandchildren over the school break next week. And that means even if grandparents have had their first dose. And grandparents, I know who you are, because you told me how excited you were to be getting immunized so that you could see your loved little ones again in person. I'm going to ask you to hold off there for the next 4 weeks. And I know this is hard. I know it's frustrating. We are so close to the end of this pandemic that we can taste it. But we need this one last effort, this one last sprint to bring the outbreak under control and to buy enough time to build immunity in our most vulnerable and at-risk community members. Schools will remain open as they did the last time that we entered the provincial stay-at-home order after Christmas. School remains safe by following public health measures. And especially as families prepare for April break, I'm asking you please not to travel, to stay at home in your own hometown or village, to enjoy as much family time as possible, go outside to hike together, bike together on trails, plant seeds outdoors or indoors. Children should play only with other children in their same school cohort whenever possible. There should be no sleepovers. And if you can, encourage your children to continue to wear their masks, even when playing outside with physical distancing. Many of them are used to wearing them now, so it's nothing new. Minister Lecce also noted yesterday that parents are encouraged to seek testing before returning after the break. I'd also recommend to families and to school staff that they continue to screen daily for symptoms, and that if they have symptoms, to get a test right away and to isolate until you've had a negative result. Asymptomatic testing can be important too. If you are concerned that you or your returning to school offspring may have been exposed and infected, PRHC's assessment center will be increasing its hours next week to accommodate any increased demand for asymptomatic testing of students and staff. For the April break week of April 12th to the 18th, pharmacies that currently offer testing and assessment centers across the province will be accepting appointments for children attending childcare and childcare staff as well for asymptomatic testing. The Ministry of Education will be working with school boards to offer school-based clinics. Parents are encouraged to take advantage of all this additional testing capacity to have their children tested in order to support a safe return to school on April 19th and to ensure the continued safe operation of childcare. Vaccinations remain one of our strongest tools to beat this pandemic. This week, we opened our appointments to anyone 60 years of age and over. We've opened up as many appointments in our city and county clinics as we have vaccine. And as of this morning, I know that they are almost all gone for the month of April. Thank you so much for seeking vaccine, and thank you also for your patience. If we get more vaccine, we will open up more appointments. We've been working with home care to identify our homebound patients in Peterborough who will need an in-home immunization, and we've had many family physicians, nurses, and even palliative care doctors step up to volunteer to assist us. Mobile teams will begin shortly to take the Moderna vaccine into the homes of our homebound patients. You may have heard or read that people with chronic conditions that put them at greater risk can also expect to be immunized this month. I'm happy to report that PRHC and all of our primary care providers have already begun the work of identifying these patients who will then be offered immunization at the PRHC clinic. And finally, we will work with our local school boards to identify and immunize the special education teachers as soon as possible, hopefully even as soon as next week. With that, I will pass it over to our next speaker, Inspector John Lyons with Peterborough Police Service. Thank you.
Hi, thank you, Dr. Salvatierra. Just to speak to the latest changes that are happening within the community and essentially across the province. We've lately received a lot of comments regarding the level of enforcement that is being provided, and questioning a lot of the things that the Peterborough Police Service are doing in regards to what we're going to be doing with the lockdown as far as enforcement goes. But essentially, it comes down to echo what Dr. Salvatierra said, essentially staying home unless it's for the essential pieces that were outlined. It is another tough period of time that we're going to go through for another month, but we all have to do this together in order for this to subside. We're not going to get there unless we're all doing this together. We will be attending calls as they come in. We are getting extra officers to come in to deal with COVID-specific incidents. We are working in unity with our community partners to try and listen to people's concerns and to educate as these new changes happen. We also understand that it can be confusing with so many different levels of the colors areas that we've been in versus lockdown versus shutdown. But essentially, we're going to try and help people through that. But we're just asking for patience and understanding when it comes to dealing with these latest measures. We are going to take a balanced approach. There are two very different stands, I would suggest, regarding enforcement of the new orders or of the existing orders. We have from defiance right to zero tolerance. We have to try and come at that from a balanced approach to make sure that we're dealing with these situations appropriately and that we are acting in the best interests of all involved. At the end of the day, that's what this is about. It's about safety of everybody in our communities. This is not done prohibitively to cause anybody any unnecessary concerns, but essentially we have to be in this together, and we're just asking for patience and cooperation when it comes to getting through this next piece that we're in right now. There's a very big difference between zero tolerance and a warning. There's officers attending and looking at each situation and dealing with it with their discretion and what the feedback is they get from the situation. So although I know that people think that, or some people think that we should be approaching every situation and charging people, that isn't always the correct course of action. We will definitely view and judge each situation as it happens, and we will make the appropriate decision based on the facts that are presented. Just as an update to I believe it was mentioned about a house party that had up to 14 youth back in March. Both homeowners have now been charged under the Reopening Ontario Act. So these investigations sometimes are obviously happening at the moment, and some take some time to develop the appropriate information to lay that charge. So please be patient. There is on top of the COVID-related calls that we're getting, we're also getting the normal run of calls, which we have to attend in a priority sequence. And I do understand that there have been some situations where there have been some gatherings that have been reported and police were not able to respond immediately. That was simply due to the other higher priority calls. It's not to say that COVID calls are not important, because they obviously are, but we obviously have to also sequence those calls, looking at all the pieces involved and making appropriate responses. So please be patient again. We are getting those calls, we are recording those calls, and we're trying to get to them as quickly as we can. But overall, it's just a case where the numbers are the numbers, and it's showing us that we need to take some corrective action. And I know it seems like that we go from an extreme to another extreme, but we're all trying to get through this the best we can, and we're trying to make sure that people's lives and liberties, to the most part, are being held to their normal. But in some instances, we have to take further steps, and that's where we are now, to try and cease that spread and to keep our community safe. So that's what I'll leave you with, and I hope everybody is safe and enjoying some of this lovely weather.
Thank you very much, Inspector Lyons, for that update on enforcement. Okay, so now we have an opportunity to hear from our elected officials, and we're going to shake it up a little bit this time and move from municipal to provincial to federal. So let us first hear from our county warden, Warden J. Murray Jones. If you've got some comments for us, please go ahead, Warden Jones.
Are you hearing me okay, Brittany?
Yes, we can hear you.
Okay.
And I can spotlight you. There we go.
Okay. Well, thank you very much. Again, thank you to everyone for what they're doing. And you know what? I think from all our perspective, we have to congratulate the province for making this tough decision. I know there's going to be criticism from all kinds of different places. But, I tried to say in our last little get together, let's stop pointing fingers. People are doing the best that they can do under this situation. We've got to work together. And talking about working together, I'm really happy to announce that the county and the city, who maybe don't always agree on things, but we are agreeing on this very important subject, along with our partners at the health unit. And we're committed to working together for our overall community. Now, I think it's a fact that's been stated we didn't want to hear, but we don't have enough vaccine to do what we need to do locally. And I guess I'm kind of getting on my bended knee to our MPPs to stand up for us here. We have, and everyone knows that, one of the highest age populations in the entire province, if not the entire country. And that's a very important thing to remember. That's the category of people who really do need this protection. We also have the highest level of the variant going on here that we can't forget as well. And we have a huge influx of visitors who are now coming, and believe me, they're coming to this area from the GTA and other places. So we are in a very unique situation here in the Peterborough City County area. And we need this vaccine as much as anyone does. So I'm really hoping, and I'm not going to accuse anybody of anything, but I'm really hoping that our share of vaccine isn't being shipped somewhere else for other reasons. So if we don't stick up for ourselves, nobody will. So the long and short of it is, we're joining the city and our friends at the health unit, and we're together on this plea to our MPPs to really get that idea home to everyone. And that's what I want to say. It is about working together. And I'm pleased to announce, Brittany, I know I had to lie about my age, but I'm going in for my vaccination today at 3 o'clock. I got in the line and I hope it all works out. So on behalf of Peterborough County, thank you everyone for everything you're doing. Let's not point fingers. Let's just work together. Thank you.
Thank you very much, Warden Jones, and very pleased to hear that you have a vaccination appointment later today. So with that, let's hear from the mayor of Peterborough, Diane Therrien. I believe she's with us today. Please go ahead, Diane.
I am. I'm trying to get my video on. I'm not sure if it's working. Can you hear me?
Yep, we can hear you. And
okay, perfect. Sorry. Thanks very much to the warden for raising those concerns. And there was a joint letter that we sent out earlier today, basically just reiterating that our community needs any vaccines that we can get. In particular, I strongly believe that our essential workers need to be prioritized as well. There's a lot of folks who don't fall into the same age category as the warden, but who have to go to work every day and deal with people. And so that's certainly something that I know is happening, and I'm happy to hear the province has been listening and taking that to heart. So again, just to say, this has been a challenging time for everybody. Certainly, not envious of the decisions that the province has to make. I spoke about it on the weekend in a social media post, and was happy to hear the sort of playing field was leveled a little bit with yesterday's stay-at-home announcement. I'll continue to advocate for the province and the federal government to provide adequate supports for those who are laid off, those who are dealing with the mental health and economic impacts of this, because that's something that we're all going to be dealing with, not just now, but moving forward. So I'll just leave it at that. Hopefully everybody can stay home when you can, recognizing that it's not always possible, that you can support local if you can, and to be kind, which we should all be able to do. So I'll leave it at that for now, and thank you very much for the opportunity.
Thank you very much, Mayor Therrien. Great to have you with us today. So we're thrilled to have MPP Smith joining us today. So I would love to turn it over to you if you've got some comments to share with our guest today. Please go ahead, MPP Smith.
Thanks, Brittany. I really appreciate this. There's a couple of things I'd like to touch on. I know that we're 12 months into it. We've been saying basically the same thing for the entire 12 months, and that is that the vaccine moves with people. It doesn't move on its own. So the stay-at-home order is designed to stop people from moving around. And if we are successful with that, then we'll be successful in stopping the virus from moving around. It only moves with people. So please, I implore all of you, do not go out unless you absolutely have to. One thing I'd like to highlight, because Dr. Salvatierra does not take enough credit for her leadership in this, or toot her own horn nearly enough for it. Some statistics that I'm not sure if she has shared in the past with people, but I'm going to share it today. In Peterborough Public Health catchment area, 89.2% of individuals over the age of 80 have received their first shot. Many have received their second shot of the vaccine. It puts Peterborough Public Health in the top spot in the province for vaccination. By comparison, we have some regions right now that have less than 50% of the 80 plus vaccinated. In the 75 to 80 age group, we have almost 75% of that population in this area with at least their first vaccine. Many of these people still live at home. They're not all in long-term care. So this is testament to the great job that Peterborough Public Health has done in the vaccine rollout here. One other statistic I want to point out, I completely understand, and we have received a letter from Public Health requesting more vaccines. Absolutely, I concur 100%. We need to have more vaccines coming to this area. One of the statistics, though, that I'd like to point out is almost, or just slightly more than 20% of the population here has been vaccinated, and the provincial average is about 14% across the entire province. So we are actually getting more vaccines than a lot of other areas, and we're getting those vaccines into people's arms, which is the most important thing. There has been some conversation on social media about vaccines being in freezers right now. I believe as of Tuesday, we had 1.4 million vaccines in Ontario, and we have 1.7 million appointments made. So we have more appointments made right now than we actually have vaccines in hand. Our hope is that we'll be able to continue receiving the vaccines in a timely fashion, and we're seeing the number of vaccines rise that are coming into the province. So this is very good news. Premier Ford has made the statement that we expect that if we have the vaccines come in on the schedule that has been given to us, that we'll be able to vaccinate 40% of those eligible for a vaccine in Ontario by the end of this month. My office receives a significant amount of correspondence from people comparing us to other regions. Others have said, and those who are opposed to the lockdown have said many, many times that regions like Florida and California do not have a lockdown. They're able to do things that we're not able to do. And I'd like to point out that Florida has 48% of their population vaccinated. We have 14% vaccinated. But we're getting there. If the vaccines come in, if they come in time, we should have 40% of everybody in Ontario vaccinated by the end of this month. And that is very, very good news. We'll see the infection rate decline. We will see the number of ICU cases and the number of people in hospital decline because of the lockdown measures, the stay-at-home measures. And then combined with that, if we're able to get 40% of Ontario vaccinated by the end of the month, we'll be in a great position as we move forward into the summer. Thank you.
Thank you very much, MPP Smith. Okay, so to wrap it up from our elected officials, I'd now like to invite our MP, Mariam Monsef, to share her comments today. So please go ahead, MP Monsef.
Thank you so much, Brittany, Dr. Salvatierra, and Mayor Mitchell for reminding us that public health matters. And Brittany, thank you for that lovely welcome to spring. I've got my window open, and for the first time in a long time, my heater is off. I would like to extend my gratitude to my colleagues who have spoken for their leadership in these really difficult times. I'll focus my remarks on vaccines, on April break here in Ontario, and on reasons to be optimistic. We have a new mission. We are at a critical juncture in the pandemic, in our country, and in our region. And our actions right now and over the course of the next 4 weeks matter. Our actions will determine the kind of summer we're going to have, whether it's the beautiful summer we all yearn, or whether it's another difficult summer filled with loss and missed connections. Like Mayor Mitchell, I believe in Peterborough. We have risen to the occasion, and we will do so again. I also support the echoes from my colleagues on vaccines. We continue to see a steady supply of vaccine shipments entering Canada. Our government remains committed to ensuring that as many vaccines come in as possible. 10 million doses have already arrived, 2 million more scheduled this week. So Dr. Salvatierra, 2 million more doses scheduled to arrive this week. Pfizer alone will be shipping 17 million doses during Q2. Moderna, AstraZeneca, and Janssen will too. By the end of this month, Janssen's vaccine will arrive. We remain on track to have 44 million doses here in Canada by June. And as Dr. Salvatierra reminds us, with that great number of 34,000, we have the capacity on the front lines to get shots into arms. So most certainly, I support the focus on populations and regions of concern. As vaccine supply continues to increase, I stand with our regional MPPs and municipal leaders on their call to ensure that Peterborough gets its fair share of vaccines to inoculate the most vulnerable and the most burdened in our communities. I would like to also speak a little bit about the Amber Alert that so many of us, probably all of us, got earlier today, the stay-at-home order. This April, we do not get a break from the pandemic. Our small businesses, doctors, nurses, teachers, moms, most burdened, elders, and essential workers have asked us to buckle down for a little bit longer. And as we enter this crossroad and we hunker down, we do so in their honor and in gratitude for the sacrifices that they are making. Our reasons to be optimistic are numerous. First of all, we have public health and democracy is working here in Canada. Governments matter. The Prime Minister spoke with Premier Ford, and the two will continue to work together and renew their efforts to fight COVID and its spread, vaccinate Ontarians, focus on childcare, climate change, and other issues of concerns for Ontarians. We understand the problems and we know the solutions, and we have more tools in our toolkit to respond. We have leaders and caring professionals running things and implementing plans and responding to Canadians and pivoting as need be. And we are so close. And we are Canadian. We've endured a difficult winter, and I know that nothing gets Canadians more excited, particularly in this region, than the idea of a wonderful summer. We can have that kind of a summer, Peterborough. This is our new mission. Buckle down for the next month, do what Dr. Salvatierra says, and let's all enjoy a summer worthy of our essential workers, frontline workers, and beat this virus back.
Thank you very much, Miriam, for your very inspiring words that we need more than ever right now. Okay, so now we will move on to hearing from our media partners, and I'm going to spotlight Dr. Salvatierra on the screen. And let's start with our radio partners with Matt Latour. So Matt, if you've got a question for Dr. Salvatierra, please go ahead.
Yeah, I've got one question for Dr. Salvatierra. It actually has to do with the end of April. I know a lot of post-secondary students, May 1st is kind of their move in and move out date. What would you suggest to them, as we're in this stay-at-home order and there's, the emergency break and all these things going on when a lot of them are expecting to move?
I would suggest that there's no better time to get involved as volunteers at the mass immunization clinics. So we could use their help. I think we need to keep in mind that we're doing first doses now, but as soon as we have more vaccine, we're going to start doing second doses. And that's going to double the need for immunizers and capacity for vaccination. So I'm going to encourage all the students to think about their communities this summer and to seriously consider immunizing if they can, if they're nursing students, or if not, getting involved. We need lots of different people, and together we have wonderful teams that make it all happen. So how's that for a plug, Matt?
That's a pretty good plug. I'll give you that. It sounds like you're reading a commercial for us. What about as far as self-isolating before somebody moves into a new student housing setting?
Well, self-isolate, again, depending on where they're coming from, self-isolation self-isolation and limiting contacts is always a good idea. So all of the public health measures are important. And right now, with only 20% of our population immunized and only with first doses, we need to continue to practice all of those public health measures. We really can't ease up on them, as the outbreak at Empress Gardens reminds us. So this is not the time. In fact, it's quite ironic that, you know, we are on the threshold of finally having the vaccines, enough of them to make a difference, but at the same time we've got the variants of concern circulating, making it so much more dangerous for everyone. So I think it's a critical time to keep practicing all of those public health measures, which include limiting your contacts, especially if you're coming from a higher incidence area into a lower incidence area, reducing contacts for those first 14 days, and ensuring that and using the COVID Alert app. It's a great tool to have, especially for students, because they tend to come in contact with a lot of others at that age.
That's it for me. Thank you. And I'll let our commercials department know you're available once you retire.
Okay.
Thank you very much, Matt. Okay, so let's hear from Rob from Trent Radio. I believe you're on the line with us. Any questions today, Rob?
Hi, can you hear me?
Yes.
Yes.
Great, thank you. I just have one question for Dr. Salvatierra. So, I mean, we've seen, of course, that there's been a bunch of new public health or the stay-at-home or emergency order, a bunch of new measures introduced. Is there anything, in your opinion, that you would want to have seen in the new guidance or new regulations that isn't included this time around?
That's a great question. And the reality is that we're still waiting for the regulations. So I haven't had an opportunity to really read the fine print yet. Typically, it takes a few days from the time that a decision is made provincially to putting that in paper and then circulating those regulations. So ask me that again in about a week, and I will have more information to give you a more informed answer.
Okay, sounds great. Thank you very much. That's all for me.
Okay, thank you, Rob. All right. I see Paul Rellinger is here with us from Kawartha now. So if you've got some questions for Dr. Salvatierra, Paul, please go ahead.
I do. Thank you. Good day, Dr. Salvatierra. Just a clarification first, if I could, regarding the Empress Gardens outbreak. The person that unfortunately passed away this week was a resident of there. I'm just clarifying that.
Yes, yes.
Okay, thank you. I thought that's what you said, but I wanted to make sure. On the vaccine front, in regards to the message sent out by the mayor and the warden, and based on what you have said today, I'm assuming there's no official word of any pending arrivals of vaccines in the next week or so, or any word on that front?
Well, we know what our weekly Pfizer allocations are, Paul. So we have that information. The Moderna vaccine comes to us twice a month. We have that data for April. We also know how much AstraZeneca was provided last weekend. So we know, for example, that 1,600 doses came to 3 pharmacies here in Peterborough last weekend. And we know that primary care received an additional 400 doses of the AstraZeneca. So we have pretty good sight lines on how much vaccine we can expect this month, which is why when we do the math, and I think this is related to the fact that we do have a higher proportion of our population that's over the age of 60. And so even though we are, as you heard, we're doing really well as far as how many people are being immunized, we're still not getting, we haven't reached everyone yet, and the demand for vaccine is outstripping our supply just because we have more people over the age of 60. So when we do the math, we could easily use another 1,100 doses of vaccine this month. If we had 1,100 more doses, we could potentially finish everyone who's 60 years of age and over in Peterborough by the end of the month.
Okay, thank you. And just one more thing,
As we look ahead to that next age group, which would be, I guess, 50 to 59 or 55 to 59, is there a concern with jumping into that area, doing vaccinations, and getting those done ahead of, while the other group above it, the 60 to 69 group, isn't finished? Is there any concern at all about getting some done there, and yet there's work to be done in that other area?
Not at all, because as we've seen, as the older vulnerable population become protected, we're seeing the younger age group ending up in the ICU and dying. So no one is invulnerable. We are all potentially susceptible. I can't tell you if you're going to get a mild dose of COVID or if you're going to end up in the ICU on a ventilator. And so the importance is to try and get through everyone as soon as possible. And that's why, for example, the second dose the interval has been extended to 4 months. And that's why NACI this week reiterated their recommendation that in the context of a pandemic, when you look at the evidence and you look at the modeling, if we want to save lives, we need to get as many people with 1 dose while that we can. And then once the vaccine supply is greater, then we go back and do second doses. So we're doing the right thing. We're trying to reach as many people as possible. And I would encourage anyone who's 55 years of age and over to access vaccine if they can. There's AstraZeneca available at 3 pharmacies, soon to be 4 pharmacies in Peterborough, and also at some family doctors who have received more vaccine this week.
Thank you so much. That clears it up a lot. I appreciate it.
Okay, great. Thank you very much, Paul. Okay, let's hear from our global news partners. Jessica Nisnik, I believe you're on the line. Go ahead if you've got some questions for Dr. Salvatierra.
Thank you, Brittany. And yes, I do. Hi, Dr. Salvatierra. Just to go over it again. So despite the deliveries that you're going to be getting of Moderna and Pfizer this month, you're still going to be dry by the end of April?
We actually dry up several times before then, because as we heard from MPP Smith, we're trying to get needles in arms and empty the freezers. So there are several times this month that we actually go down to 0 and wait for the next delivery to arrive. So we're getting everything we can out. And as I said, I believe it reflects the fact that we do have an older demographic here in Peterborough. And it also reflects the fact that we have done second doses. We've started second doses in both First Nations communities as well. So that again has been a drain on our vaccine allocation, which is great. It's all good, but it means that we have more people waiting for vaccine and wanting vaccine and currently eligible. So I think it just reflects a real hunger for vaccines here in Peterborough. I'm not detecting any vaccine hesitancy here yet in the age groups that we're immunizing and in the other higher risk populations that we are trying to reach, which is all great news. It really is the best case scenario, Jessica, that we have so much interest and desire for a vaccine, because that's what's going to get us out of this pandemic.
Right, thank you. And lastly, I know Paul just mentioned this, but if by the end of the month, are we on track to reach the age target that we're supposed to be? Who will we have done for their first doses by the end of the month?
Well, we will. Right now, we are booking people 60 and over till the end of the month. That's what has been opened up across the province. That's what is targeted for phase 2 of the vaccine rollout. But as you know, there are other groups also in phase 2 that we are starting to do as well. So we are going to start with our high risk congregate settings, and we are already making plans to begin with our homeless shelters and our other shelters in Peterborough to get them done. as well as all those those chronic conditions, people with chronic conditions. We're working on that group as well. We still haven't completed the housebound home care patients. They are part of phase 1, and they are still a group that we need to finish this month. So we have a lot of irons in the fire here. Many groups that we're trying to do simultaneously in this month. It's a very busy month for us.
Okay, thank you. And Dr. Salvatierra, what do you think about the teachers and teachers unions request to be done over the break? In addition, you know, there's a lot of people saying factory workers, and I know they're not up yet, but these are the areas that we're seeing some concerns. What do you think about certain groups like the teachers or those factory workers being bumped up a bit?
Well, certainly we know now, as of yesterday, that there will be vaccine made available in the hotspots for people as young as 18, including teachers and including essential workers, and that makes a complete sense to me. I wish I had enough vaccine to do everyone right now, but I don't. And we heard how hard our federal government is and what a great job they're doing at getting the vaccine for us. But we have to stage it. We just have, and some people have to wait. And because, you know, although for us, 50 cases per 100,000 seems a lot, and it is, we have to keep in mind that in some parts of the province, it's 4 times that rate. And so there is targeted immunization occurring. I really appreciated the way MP Monsef phrased it as populations and regions of concern that we have to reach first. And in those areas, we will see those essential workers, those factory workers, those teachers getting immunized before people, the same populations are being immunized here in Peterborough. And that just reflects the fact that those areas have much higher incidences and much greater risk.
Okay, and lastly, I believe Mayor Mitchell said that Peterborough, our region, is one of the highest rates of VOCs. Is that right?
That is correct. About 80% of our cases test positive as a VOC.
Okay, thank you very much, Dr. Salvatierra. That's it for me.
You're welcome.
Thank you very much, Jessica. Before I move over to Joelle from the Examiner, Dr. Salvatierra, I just want to confirm a number shared earlier in your conversation with Paul Rellinger. I think the number of doses that we are hoping to that would make a difference for us to complete the plus 60s in April it's 11,000 doses?
No, it's one. I'm going to have to look at that number, Brittany. Now you've made me wonder. I'm just going to check the number and I'll get right back to you.
Okay, sure. Sorry about that. Okay, and while we're waiting for that, I will invite Joelle to get ready. And when Dr. Salvatierra is prepared for us, we will we'll open it up to you to ask your questions.
So I'm back. Thank you. And so it's almost 11,000 is what we're short. And my apologies if I misspoke.
Okay, great. Thank you very much, Dr. Salvatierra. Okay, Joelle from the Examiner, please go right ahead.
Okay, now I'm real confused. 11,000 is the amount we're short, or 1,100 doses?
11,000, almost 11,000, Joelle. It's 10,000 and a few hundred. I don't have the exact number. I would say it's close to 11,000. And the reason why I don't have an exact number is that we're still enumerating the people with chronic conditions who become eligible this month. So all those people, if you look at the phase 2 guidance and you look at the highest risk, high risk, and at-risk conditions, and you'll see things like, you know, organ transplants or people who have diabetes. We still don't know the numbers in Peterborough. We don't know how many of those people have already been done, and how many are under 60 years of age and are yet to be done. So we still don't have exact numbers, and until we do, it's going to be a ballpark estimate of what the need is, what the deficit is. And that's why I'm saying it's about 11,000.
That really, really helps the way you just explained that. Now I'm going to ask a real simpleton question, and 11,000 would be the total amount roughly that you think we would need. We're not 11,000 short, right? Am I understanding that correctly?
I mean, if you look at how much vaccine we've had and how many we've immunized, you could say we're doing a great job. But when I look at the numbers, so for example, when we look at our population that is 60 to 69 years of age for Peterborough, you know, we estimate that there are about 22,000 people in that population. So when we look at that, and then we keep in mind when we do estimates as to how many people with chronic conditions, we still don't know yet, for example, how many special education teachers we're going to be expected to immunize next week. We haven't received that list yet. So we are still, so when we look at that and we look at how much vaccine we have or can expect to be delivered for the month of April, that's where we're getting the shortage. We know how much we're going to get. We know all those appointments are booked now until the end of April. And we know how many people we have in total that we still have to do. So that's how we're getting the 11,000.
Okay, 11,000 being the shortage, not the total amount that you need to vaccinate all, right?
Not the total amount, because that 11,000 is the deficit. How many more doses we would need.
Excellent. Okay, thank you so much for being really patient explaining that to me 3 times. Okay, did the Evinrude Center have to close early yesterday?
No, but what happened is we went up to Curve Lake and assisted Curve Lake in getting second doses to their community. So that's why it was pretty quiet at the Evinrude if you drove by. So we did, we had a large turnout yesterday at Curve Lake. And again, you know, we are going to have, we're getting second doses to both Curve Lake and Hiawatha this month as well as part of our vaccine rollout.
That explains it. Okay. And when you were talking about the variants of concern a little earlier, I know that I haven't checked the website in a long time. It seems to me the one variant of concern that was identified in one case was the one that first emerged in the UK. Do we know if any others have emerged? Which ones are we talking about? All of them?
So I have to go and check the latest, Joelle. I haven't, but I would say that the vast majority of what we're seeing here in Peterborough are the B117, which is the strain that was first identified in the UK. And there's new testing that's being done in Ontario. It was introduced a couple of weeks ago. There's a 2-step process. And depending on what the screening results are, we can determine with a great degree of confidence which of the 3 variants of concerns we're dealing with. And I would say, as I said earlier, the majority are B117 for Peterborough.
That's wonderful. Okay, great. Thanks so much. I hope you're nice and vaccinated yourself there. All right, all done.
Okay, thank you very much, Joelle. So with keeping the theme with the examiner, Reg Watson, did you have any questions for Dr. Salvatierra today?
I think you're on mute.
Sorry, I don't have any questions at the moment.
Okay, thank you. All right, then I will move on to Bill Hodgson's from My Kawartha and Peterborough this week. And I believe he's our last media reporter on the line. If I've missed anyone, please just put your hand up. But Bill, please go ahead if you've got some questions for Dr. Salvatierra.
Just a little clarification on the pharmacy program, the AstraZeneca. You said 1,600 doses had arrived, maybe another pharmacy coming on board. Have those 1,600 been allocated already? And I'm thinking people wanting to register, should they wait until the end of the month before they try again?
I think if you're 55 years of age and over and you're looking for a vaccine, you can get AstraZeneca. Currently, those 1,600 doses have been provided to Costco, to the High Street Guardian, and to the Walmart on Chemong. So I can't tell you the breakdown of those, how many went to each of those 3 pharmacies, but I can just tell you that we received word that they were receiving in total 1,600 doses.
Okay, so with another pharmacy coming on board, again, should we wait until there's an announcement of more AstraZeneca coming, or should people still follow through and register?
Well, again, so the 4th, I just got word this morning that there was going to be a 4th. I don't know if it's been publicly shared yet, even with the pharmacy itself. I was just asked if it was an appropriate choice. And so I don't know how much and when they're getting their AstraZeneca. We do have a call tomorrow. There's a provincial call on pharmacy allocations, so we may have more news tomorrow. But for now, I would say that the sooner you get your immunization, the better. I mean, and as we've said, the best COVID vaccine is the first one you can get. So if you can get it, if you from one of the pharmacies, and you're interested in getting the AstraZeneca, then please go ahead. Let's use it up.
All right, perfect. Thanks.
Okay, thank you very much, Bill. Okay, I think that brings our media scrum to an end. What I would like to share with our guests on the line before we move along is that now that we have returned to a stay-at-home order, these media briefings will also return to a twice weekly cycle. So we will resume media briefings on Tuesdays and Fridays at noon. So I will be sending out a media advisory with the new link, as well as an invitation to those who are already on the invitation list. So stay tuned for that, but we will see you back here next Tuesday. And thank you very much for joining us today. Oh, hello.
Yeah, sorry, it's Paul. Is that effective starting next week?
Correct.
Okay, thank you. Thank you.
Yeah. Yeah, and I will be sending out the advisory, and it will be a new link, not the one we've been using for the Thursday briefings. So thank you again, and stay safe out there and enjoy this lovely weather as safely as you can. Take care now. Bye-bye.
Thank you, Brittany.